Welcome, welcome everyone on Facebook land. So today we are so delighted to have a panel of doulas to talk about doula care and what that looks like, the different types of doulas and what they do. Doulas have a really warm place in my heart because I was lucky to have been introduced to doulas with my first baby and was able to have that level of support. And I don't think I would have otherwise. I think I owe a debt of gratitude to a friend who was a doula at the time who introduced me to that idea. And so I'm just thrilled that we have several doulas today on this panel to talk about doula care. And our doulas today are from the West Valley, serving West Valley families. And so I want to go ahead and introduce them to you this morning. So we have this morning Lisa Lopez and Tajanita Bush. Lisa is a professional birth doula serving the West Valley and Greater Phoenix area. And her goal is to provide evidence-based care so families know they are in charge of their experience and that their voices matter most to help them achieve the birth they desire. Lisa is trained in spinning babies techniques, prenatal yoga, and certified in trauma prevention and also pregnancy and infant loss. And Tajanita Bush is a birth and postpartum doula in the West Valley. And Tay's goal is to educate and share positive yet real life views into the birthing and postpartum world, both in the joyous parts and the hard parts. She's passionate about sharing the raw moments of things going totally smooth or completely off track from what your expectations were originally. She wants to show new parents that there is hope and healing in the beauty and messiness in birth, and to assure you that you're not alone in your experience and emotions that come with all 4 trimesters of growing and loving another little soul, whether it's your first baby, 10th, or even your angel baby. So welcome this morning, Lisa and Tay. We're so delighted to have you here. If you want to wave to everyone in Facebook land.
Thank you for having us.
Yeah. I can't say enough good things about doulas. We took a birthing from within class with our first baby because we were friends with a couple where we knew the husband, and the wife was actually a childbirth educator, and she was a doula. And they were like, come on, you should maybe take this. And, you know, they were so nice, like gently, like guiding us into that. And I remember all those conversations around like what could happen and making sure that we were prepared for all of that. And that was so different than what we had thought birth would be like. And so it was really good to have that preparation. And she was also the one who was like, get a doula. You really need a doula. And we were very much persuaded because the doula that we decided on at the time called herself the massage doula, which was that was very much desired by both of us during that time, although I'm the one who got the massages. So we slid very gently and happily into this world of doula support and never looked back. And I think my husband, after having a doula there, you know, he was just like, oh yeah, we're never doing it any other way. I don't want to have to be the person who's solely supporting you through this. This isn't my wheelhouse. So yeah, we were really, really lucky to have that introduction to the birth world. Awesome. Well, so I wanted to start by sort of just kind of breaking down what doula means. And, you know, when I look back to the root word of it, it's originally is like a woman who serves, right? So someone who is supporting and serving another person. And what it's come to find now, as far as I understand it, is, you know, providing emotional and physical support and information, right? Like lots of information, and making sure that the person who is birthing or whatever is being supported, that they have all the information to make the best decisions. So yeah. And I wanted to just go into a little bit about what kinds of doulas are out there. So maybe if you guys could speak to that. I know you are experts in what you do. So, you know, whoever wants to chime in at whatever point, go for it.
Well, there are many different types of doulas, and specifically speaking about, you know, family building, I guess. There's birth doulas, there's postpartum doulas. There are also doulas who serve on the other end of life, where it's, you know, end of life doula care. Yeah, Tay, do you want to?
There's fertility doulas that help
yeah.
with the preparation of, you know, leading all the way up to getting pregnant. There are doulas like full spectrums. I know someone here is a full spectrum doula. So they walk through all the way through fertility, even down to loss and abortion. So the biggest thing is making sure that whoever we're supporting, they do know all their options. They do know all the evidence behind it, both medical and holistic, because, you know, you have options. And then just fully educating them on this is how it unfolds and this is the different variations of it. And then being the emotional support to walk with them through that, whatever chapter of life they're in.
Yeah.
Sorry.
You know, it totally makes sense. We've all got kids, dogs, and everything else in the back. So yeah, totally understand. So maybe I want to open it up to questions for the people who are joining us on Zoom first. If you guys have any questions you want to ask, I know I have a whole bunch of them, but if there's something specific you're thinking about asking related to this, please, yeah, go ahead, either now or, you know, as we move forward.
I have a question. So what is like the best way to introduce like a partner who maybe doesn't know anything about doulas, maybe will feel like threatened might be a strong word, but kind of threatened by having somebody else present during the birth? Like, what's the best way to like ease them into the idea and help them see like the good things that doulas do?
So I love this question because a lot of those partners who are threatened or afraid of bringing somebody else into, if we're talking like, for example, the birth environment, you know, we're not there to replace the partners. We're there to not only support the person who is giving birth or in the postpartum stage, but also partners, also families. I always like to ask when I like to have the partners there if they're involved or family members and ask them like, how do you envision supporting your loved one? And then once I get an idea of that, for some of them, they want to be hands-on. So then I know, okay, so then I'm more of the informational support and the emotional support, so most of my clients are husband, wife, male, female. So the birthing person and then the husband, you know, they, especially when it's their first or second kid, then something kind of goes a little like, is this normal? Like I can be the emotional support for him and like, this is great. Like, this is what we like. This is normal. Or here, why don't we try this? It's the providing that informational support so that at the end of the day, the birthing person or the postpartum person can think back on their experience and be like, man, like you had all the tools to support me. And, you know, had a doula not been there, sometimes like they don't know how to like she's getting kind of vocal in labor. Is this normal? Is there something wrong? Like, no, vocal is good. This is where just to keep encouraging her, keep massaging her, keep reminding her how much you love her and will support her. And, you know, in the postpartum stage, like, hey, the hormone shifts are normal. If she cries because she dropped a fork, that's totally normal. Just, you know, rub her shoulders, ask her if she needs anything. You don't have to fix the problem. Just let her feel her feelings. So we don't replace the partners. We empower them to provide better support than, you know, just kind of flying by the seat of their pants and guessing like, I think this is what they need. I think, you know, so it's not, we're not there to take over. We shouldn't be a threat. If anything, it's just to enhance the situation and make the other person feel confident in supporting their loved one. And then it's also nice, you know, when I have clients who say like, well, you know, I'll have my sister or my mother there instead. Doulas also, we don't have, not that we don't care, and I always have to explain this part, it's not that we don't care about our clients, but we come from an emotionally removed space so that we can take it all in and not feel totally like emotionally involved when making decisions. We can be the, hey, this was the one on your birth plan, or your preference list or whatever. Like, this is what you've been envisioning this whole time. So do you want to stick by that or do you want to change paths? And if so, then let's talk about what that will look like versus look like you're in a lot of pain. Let's go ahead and like intervene somehow, even though that's not how they've been envisioning their path this whole time. So we don't get wrapped up in the emotions. We kind of help keep everything like, we like to be the level-headed person to kind of help everyone be like, okay, yeah, let's get back on track and focus. So.
Yes, exactly. And what I like to do, especially when I'm meeting with clients or potential clients for the first time, is make sure that their partner is there with them. That way, if their partner is apprehensive or, a little bit doubtful, I don't know if I want someone I don't know, a stranger, helping us through this very important and intimate time. I'm able to be there to address any questions that they might have, or help ease their concerns. And just like Tay said, big part of what we do is helping to figure out, okay, what is how do you feel you can best support your loved one during this experience? And how can I help provide those tools if you don't have them already, or enhance what you already do know or about your relationship with this person? How can I help facilitate that so that you are giving the best support based on what you feel comfortable with? Some partners want to be completely hands-on. Some partners are like, I just want to stroke the hair and like massage the hands, and I want to tell this person how much I love them. Awesome. Let's make sure that I'm taking care of like the hands-on stuff and getting her the ice chips and making sure that the water in the tub is warm, and you go ahead and just be with her and be present. So it's a lot about also figuring out the one who's apprehensive, usually the partner, if there is any apprehension, what is it, what questions do they have that we can help provide them answers? And how can we also help them understand that if this is what his partner wants, and this is what the partner is looking into, that it's really important to honor her wishes, to at least explore it and to find out how can we make this a comfortable thing, because both partners have to be on board. If one's on board and the other one isn't, then maybe it's just not the right fit. Or maybe there just needs to be a little bit more of education there. But exactly like Tay said, we never ever replace the partner, the support, even, the family members that want to be there. Our job is to really help facilitate exactly what they do want, and help make sure that at the end of the day, they walk away from the experience with that relationship enhanced and that experience enhanced between the two of them, or the sisters and the cousins, or the, whoever else happens to be there, those relationships enhanced. And we're really just kind of like background. We just kind of helped facilitate that environment.
Mm-hmm.
We're the flies on the wall, unless you
Exactly
really want hands-on support. But we're really good at melting
right
when needed.
Mm-hmm. And we also we provide a little bit of perspective. Like, we can be emotionally detached in that we're not going to get wrapped up in like trying to rescue in the moment. So we can kind of provide that perspective of like, this is okay. Let's see how this next one goes, and let's see what the coping level is. Maybe we need to change things up. Maybe we need to talk about doing something different. Maybe we need to talk about if we need to go to plan B or plan C. So it's a really good place for us to be, that emotionally detached, not robotic at all, but more just allowing to provide that perspective, that level head, that clear head in the room, that has that information to help bring everyone back, like ground everyone again. Like, all right, let's bring it back in. Let's focus, let's breathe, and then we can have those discussions. So I think it's important. We try to make that very clear to both parties. That way they understand that no one's trying to push anything on them. No one's trying to change their relationship or interfere. But we're there as a resource. We're there as pure support for whatever that looks like for them.
Awesome. That was a great question and great answer for both of you. Yeah. So one thing that I feel like maybe would help too is talking about like how a doula and how that care in birth looks different than like your midwife or the nurses that are in the room, or the OB. Like, how is that a different role? What does that look like compared to, because some people might think, oh, I have a midwife, so, I don't need a doula, or there's nurses in the birthing room. What does that look like in terms of the difference between that type of support?
Absolutely. Nurses, they have several patients at once that they're taking care of. First and foremost, we're completely non-medical. So we don't do any type of checks, any type of fetal heart rate monitoring, nothing, all of that. We don't do any of that. And in terms of, we provide that continuous support. Whereas a nurse is going to come in and out, and nurses, most of them are so amazing and wonderful, and they really want to help and provide that emotional support or that, you know, physical support in the way that they know how to. And they also have other patients that they're checking on, and, you know, they might get called, okay, well, I've got another patient who's about ready to birth her baby, so I've got to go. We're there continuously. As far as midwives are the medical care provider. Like I said, we are completely non-medical. So I like to think of it as that we, as doulas, we kind of stand in that gap. We kind of fill that gap of where the medical side of it is taken care of, the support side of it, we can help it enhance. And then we stand in that place where we can kind of bridge those two together to help communicate, help with communication between the two, to help with that continuous care, so that whoever, you know, the birthing person doesn't ever feel like they're left alone. I mean, there does come a time when the partner needs to go and take a nap for, you know, a half hour to recharge, or needs to even just use the restroom or go grab something to eat real quick. And so we stay there to stand in that gap to provide that continuous support, so that there always is that one-on-one at very minimum. You know, the nurse's job, the midwife's job, the OB's job are so important, but they're also very highly focused on the medical aspect of it. Whereas we can provide more of that emotional aspect of that support and the information as well.
And we build that relationship, you know, as early on as we possibly can. I mean, there are instances where I've been hired the day they went into labor. So building that relationship is a little bit tougher, but it's still available, you know, through communication. So we're trying to remain that constant of like checking in and being that friend as well as that professional support. And so, you know, like Lisa pretty much just hit the nail on the head with it. We're that bridge between the medical, the support, and the emotional, but we're also that constant. So while shift changes and your doctor might not be the one that's there, you know, or even a midwife might be at another birth and have to send in a backup, like unless for whatever reason we had to send in a backup, but most of the time, like, we are the ones that are guaranteeing that we're going to be that constant for you. And that kind of helps make the environment feel a little bit safer, just that familiarity.
Yeah, I think that makes a lot of sense. And I can just speak to, in my first birth, there got to a point where they had to give me oxygen, and they wanted to roll me over, and I was sort of out of it and didn't really understand what was going on. And my doula came over to me and massaged me, and she was like, okay, Jenny, this is going to be okay. It's all going to be all right. We just need to turn you over. And she was just so gentle with it that I just did it. Right. I was like, okay, sure, whatever you say. Right. Like, versus what was happening around me, which was people were panicking a little bit. And I think my husband was probably a little concerned, right? And so my experience of that was, oh, okay, we're just doing everything that's important for your baby. So yeah, I agree. I think it's just different. Yeah, it's just a different type of support. So yeah. And I know, Fleur, you just joined us. I don't know if you had any questions, but don't mean to put you on the spot, just in case. Yeah.
Sorry, I just was put out by my agency, and I honestly don't know what the role of doulas was. So I was like, oh, that's the perfect time to just get some information, but no questions.
Awesome. Yeah. Well, if you have any, please let us know. Yeah.
Thank you. And I just realized I'm not muted, so sorry for all the ambient noise.
No, we're not getting any. You're good. What other questions do people have? What are their thoughts?
How do the families tend to find you? Do you find that midwives are recommending your services to their clients, or is it, like Jenny mentioned, she had a friend who was a doula, and so that's how she got introduced to the idea? Like, how do people get connected with you?
So there's a lot of different avenues. My very first client found me because I was on Doula Match, and I'd only been on there for a few weeks, and she came across my profile and just called me up. And then there are, as we start, getting rooted in the birth community, we make those connections with OBs and midwives and, just say, hey, we're here, business cards, all of that, then yeah, the referral, the word of mouth is definitely an honor to be referred that way. And then a lot of times I get a lot of inquiries just via, Google search, just type in doula near me, or I've had a couple that came across like social media. I'm a birth photographer, so seeing, that educational side of things and reaching out, asking more questions and clarification. So it's we're a lot of word of mouth, a lot of, personal referrals, or just, I just typed it into Google and there you came. So.
Yeah, there's even like some other types of providers, like chiropractors have sent referrals before, physical therapists have sent referrals, and simply just being in the community as well. Sometimes just someone from not even attached to the birth world called up and says, hey, I know a friend of ours is pregnant. Can I give them your information? It's like, sure, that's great, thank you. And then, repeat clients or clients who have other friends who are pregnant, and then they refer. But yeah, OB offices, midwives, sometimes midwives will work specifically, they have like certain doula perk programs where if you hire a doula, then you get a little bit of a discount off of their service package, because midwives tend to see the value in doula support a lot more often, simply by nature of home births and the environment. But yeah, we can get referrals off Google. I have one client who's just like, I just typed in doula West Valley Goodyear and your name was the first one that popped up. I'm like, great. And so she interviewed with me and a couple others, and she's like, yeah, so yeah, that's how I found you. That's great. Like, okay, I didn't even realize I was going to pop up that way. But yeah, there are Doula Match websites. There's a couple of newer ones also, but Doula Match has, I think, probably been around a long time. Plus also, if a doula happens to be certified through a certain agency, sometimes those organizations will have a list of certified doulas by area or by region, that people can go on to as well. So yeah, it's a lot of word of mouth, and social media is a little bit hit or miss, but someone will maybe just even go on to like a mom's group on Facebook and say, has anybody ever had a doula before? Can someone tell me more about it? Or I'm looking for a doula. And sometimes that's how we get referrals as well. So it's kind of random.
Yeah, I was going to say Arizona Moms and Doulas Facebook group I'm part of. I feel like that's a spot where people come on asking for doulas frequently, but yeah, it is interesting. It's not more systematic.
I didn't know about that website. Could I put that in the Facebook, in the comments? Would that be okay if I put that in there so people know how to find it?
Sorry, I didn't realize I was muted. Yes, please. That would be great.
Okay.
Yeah, Doula Match. That's great. And actually, Tay, if you wanted to just shout out a little bit about that West Valley Birth Expo. I know that's another place where moms can find, doulas and birth support, and it's coming up really soon.
Yeah, so next Saturday, November 13th, at the Moment of Truth Healing Space. So it's off of 83rd Avenue in Bell, around there behind the Autoplex. But it's basically, I helped create the West Valley Birth Collective, and we've brought together doulas, midwives, an OB midwife practice. One of the West Valley hospitals is going to be there. Chiropractors, pediatric naturopaths. There's a ultrasound tech there offering discounted and even raffling off a free ultrasound. We have so many amazing providers, and they're kind of slipping my mind. But if you go to West Valley Birth Collective, we're slowly starting to introduce all of the vendors that will be there. And it's basically just an open house. There's no like ticket fee or anything like that. You come, there's some amazing giveaways. Like my husband is asking if we can enter the giveaways. Amazing giveaways that you just come, we give you a raffle ticket and you enter. So it's as simple as that. And then, yeah, you come meet just various providers, and oftentimes, our first one was so successful. It was interesting to see that sometimes some of the families came and they met people that they clicked with, and it just kind of saves time from having to schedule various, meetings. Like, for example, if someone saw Lisa and I, just out on the street or heard a referral, they would have to schedule individual consults, where this is just kind of like, walk up to our tent, chat with us. Sometimes you vibe right away. Sometimes you're like, okay, like, not really interested in that person. Let's see if, the next person is our person. And then just get a bunch of information for the people that we haven't been able to like bring in or can't be there in person. We grab information. So every family is given a resource bag with tons of other, so whoever isn't there, so other OB practices, other like local chiropractors, just information. It's basically come learn all of your options. We call it the Birth Expo, but it's not just birth. It's providers who walk with you in all stages. So so it's just a perfect open house if you want to come. It's outdoors, and I promise you, at least for the raffles, and there's food trucks and all that, but I promise you don't want to miss it. It's awesome.
Awesome. Yeah, I think that's a great place, especially if you're in the West Valley, to be looking for a doula and, other types of providers that you might be interested in, maybe just exploring what they do, right? Like maybe you're not sure you want it yet, but just like, let's just have a talk. I think that's
some of the providers that are going to be there also are things that like sometimes they don't even know that is something available to them, like a pelvic floor specialist.
Floor therapist. That's where the space is being held at Moment of Truth, pelvic floor therapist. Yeah. And
but it's
samplers.
But so many clients, when I bring it up to them, like, let's talk about pelvic floor therapy, both prenatally and postpartum, like, what is that? And why do I need that? It's like, great, let's explore this and let's talk about it. So there will be providers like that as well, where they can come and see like, oh, I didn't even know that was something that I might need, or maybe I've had an issue in the past and that would have really helped. So it's a great resource that the West Valley Birth Collective has put together.
Awesome. Yeah, I'm going to do my best to be there. So yeah, you may see me introducing myself to everybody. So I want to switch gears just a little bit now, and I want to go from pregnancy and birth into postpartum. So I wanted to just have a little bit of a discussion about what a postpartum doula does, what that might look like, what are the different things that might look like in your home, right? Or wherever that occurs. And why somebody might want a postpartum doula. I think that would be another good question. I know I was sharing before this started that I feel like most of the people I work with at the breastfeeding center have some idea about what a birth doula is. But when I bring up a postpartum doula, they're like, what on earth is that? So yeah, if you want to just share a little bit about maybe first what they do, and then like what those visits might look like.
Yeah. So I'm a certified postpartum doula as well. And I became passionate about it because I never knew that actually existed. But basically, postpartum doulas fill in our goal, our job, and our goal is to make the transition into parenthood, whether it's your first baby or you've had multiple, but just to help that transition from birth into settling in at home just as smooth as possible. And there's a lot of factors that go into, monitoring. For example, we still offer the physical, the emotional, the informational support that a birth doula offers, but it looks a little different. So a typical shift for me might look like going in and I sit on the couch with mama for a little bit and we talk about, in the beginning of our relationship, I like to talk about the birth. Let's talk about your birth. How do you feel about it? Is there anything that you need to process? Do you have any questions, concerns? Do you need more information about understanding why did certain things happen? Is this normal? And then emotionally, how do you feel about it? Because so often, we birth our babies and then we're sent home and then we're left to like internalize what just happened to us. And even on the most like healing, beautiful birth, it's like there's still parts where we're like, was that normal? Should that have happened? Am I doing this right? So processing the birth is a really important step into building that relationship with my postpartum clients. And then we start going into, I like to talk with her and just see like, okay, so how did the night go? Or how's the transition going? And then usually it turns into kind of, I'm not a counselor or therapist, but I'm there as a friend to really let her like, just like, sometimes it's just word vomiting, and sometimes it's like, yeah, things are going good. And I can sense that there might still be some anxiety or anything that just like, red flags for potential maternal mental health disorders or postpartum anxiety, depression. Really looking for those cues and offering information, whether it's a resource for a professional because sometimes, going to therapy can help alleviate those. And then sometimes it's another professional who can help with medication if that's the route that needs to be taken to help. Postpartum depression and anxiety is awful to experience. I experienced it with my first, and I would never wish it upon anybody. So I really do try to have those conversations every shift of like, let's talk. How are you feeling? The first 2 weeks postpartum, the baby blues is normal, but so many of us were like, the physical and emotional, like, why is this happening to me? So I'm there to say like, this is what's going on in your body. This is totally normal. Be gentle with yourself. What can I do to make this easier? I'm as a postpartum doula, I'm not there to take over the role of parenting. So I'm not really that hands-on with the baby unless the mother really like, can you please hold baby while I go take a shower? Or, sometimes I'm like, do you want to take a nap uninterrupted? I will gladly, rock baby to sleep while I get your laundry done or, dishes, or can I make you a meal? Make sure that you're eating. Not a 5-star chef, that's my husband. But I can make it, a killer peanut butter and jelly sandwich or a nice stew. So whatever you need for that, but really just taking care of just the little things that people forget about, So often we have family and friends want to come in and hold the baby and meet the baby, but who's holding the mom and who's holding, who's holding the family? And so also, once again, doulas aren't there to take the place of the partner or any family members. So if I have a client that has a very supportive family dynamic, I'm there to like kind of help facilitate, just like in a birth environment, I'm there to facilitate, maybe hypothetically mother-in-law seems to be like, overbearing for a very, freshly new mother. So helping like, hey, like this is something that she expressed to me would be really helpful. Can you help me with this, Or how about we give her some space to take that quiet time and encourage some self-care? Or it sounds like, she's in a deep rut of baby blues and just really emotional. We don't have to fix her. We can just let her cry and just be near and let her, sometimes just being there and holding space for that is enough. And so just giving the tools to the support partners, both while I'm there and then for when I'm not there. So that way they can understand like, okay, it's nothing that we're doing that's causing these, the crying or the anger or, even the anxiety. This is part of the healing process. Her body just went through a lot of stuff, bringing this baby into this world. And so we just need to support her where she is. And that's where the information and the emotional support from a postpartum doula comes in. So I mean, it looks like a birth doula, but it translates into a little bit more in terms of, feed the mama, help the mama, I don't, especially in the first few weeks, I'm like, I want you to stay in the bed if you're comfortable and just nurse that baby and snuggle that baby and rest as much as possible. And I'll take care of the rest. And if there's other siblings or, fur babies in the house, then I'm kind of tending to them and helping them, with the transition as well. Like, yeah, that's your new sibling and this is how you can help. And are you excited? And, helping them process their emotions and that too. So yeah, it's kind of it can look a lot of different ways. There are postpartum doulas who come in and they do the 5-star meal prep, and it's all from like an Ayurvedic education of like how food is nourishing to the body and all of that. So there's like belly binding. There's a lot of different avenues. So, when looking for a postpartum doula, my biggest thing is like, how are you envisioning, your healing process. You know, we always, and postpartum doulas we're there for the 4th trimester, which is about the first 12 weeks. So anything past 12 weeks, we're kind of looking more into like extended caretaking, which is where I would make recommendations for like a nanny or an newborn care, or nanny, or like an overnight. There's like sleep consultants, or the names are slipping my mind, but there's other professionals who go past the first 12 weeks. I'm there to help with the 4th trimester, with the healing process and adjustment and transition into parenting.
Yeah, and I would like to add, just as a birth doula, I'm not a postpartum doula. As a birth doula, though, one thing that is really important for me to stress with my clients, like, let's prepare for postpartum. We don't prepare for postpartum once it's already happened. Let's prepare for it right now while you're still pregnant. That way we can set you up for the best possible outcome. So a lot of education of what can you do now for yourself, if that's what you want to do, to prepare yourself in terms of make some extra servings of dinner and freeze it, or prepare some freezer meals, or line these things up for yourself postpartum. But also, let's look into hiring a postpartum doula. Let's look into who are your resources. Let's take care of that stuff now. That way it's not, I'm home from the hospital, it's week 1, I'm completely overwhelmed, I don't know what to do, and now I feel overwhelmed that I have to figure out who to hire to help me. So it's something that I feel is really important as a birth doula, to help the clients prepare for that postpartum, that 4th trimester during the pregnancy, because it's so valuable. And I do see a difference when I do those postpartum follow-ups, because I do postpartum follow-ups, but it's just a visit. It's not extensive support as Tade does with her visits. Mine are, they're not 4 or 5 hour long shifts. So, and I do see a difference with my clients who have hired some extra postpartum care support and those who haven't. And it really does, whether it's your 1st or your 5th or your whatever child, it makes a huge difference. So it's really important, that education as well during the pregnancy period.
There are often times that I'll have, like, my birth clients will hire me into postpartum care, but for those clients who just hire me for postpartum care, I like to meet with them before they have baby and talk about, like, what, how are you envisioning me supporting you, and that a lot of times after baby's here, things can change. So sometimes it's like, yeah, we really want you to come in during the day, where I do a minimum of 4-hour shifts, and I help with like the light housekeeping, the emotional support, the informational. Like, I do like them to have a lactation, meet them before you have baby, or at least have the list of resources that you will most likely be utilizing after baby at least made, so that you know where to refer to versus researching things after baby's here, like Lisa said. And then with birth clients, like with clients that are just birth clients, yeah, definitely having that conversation of, okay, so what is your postpartum support plan? And that's where they said, well, church will do a meal train, family will come and help. And then, like, helping them though also establish those boundaries early on for when family and church friends and all of that want to come, because it can be like, it's exciting thinking about, like, I'm going to introduce my baby to you. And then there's people like me with my first, where I was like, yeah, I went off and I did everything and everybody got to meet the baby, and then I was sleeping 2 hours and that's it. Like, where did my postpartum recovery go? Like, there were no boundaries made. There was no planning. I was frantically Googling lactation consultants at 2 a.m. because I didn't prepare for that. So preparation, planning, yes, plans change, but at least knowing what all of your plan A, plan B, plan C could be. And then I do have clients, there's a 4 to 5 hour shift during the day. And sometimes they say, we just need to sleep. Like, we really need help with sleep. And so then I'll come and do an 8-hour overnight, where I'm a little bit more hands-on with baby, so that mom and dad can get, longer stretches of sleep. And then depending on their feeding preference, I either bottle feed or I bring baby in so that they can nurse. And then I bring baby out so that they can go right back to sleep. So it's just a matter of, like, what's important to you. And what do you feel like you really need to just help? Sleep is important for mental health. Not feeling like you're living in a cluttered house is important for mental health, and having someone to talk to who knows what signs to look for when it comes to mental health disorders, especially maternal and paternal. I always tell my dads, like, you are just at risk for postpartum depression as mom is. And so these are the things to look for. And these are, let's be honest about our feelings and emotions here and talk about them, and we can get you help if you need, or sometimes it could just be a communication with your partner about, hey, this is what I'm feeling. How can we work through this?
Yeah, thank you both. I think that was super helpful. Yeah, to start thinking about what that might look like. What other questions do we have, ladies, who are listening? Or thoughts, maybe?
I think the role that you mentioned, kind of screening for all sorts of things in postpartum, I think that role that you have is so important. And from a mental health point of view, from a physical recovery point of view, all the things. So I just think it's so valuable because, we just don't have the system in place for, I think, appropriate postpartum follow-up with our birth providers. And so those things just really get missed. So for you to have, like, feet on the ground in the house, it's really fantastic. So that's really a good value for those moms.
Absolutely. I agree. I think that a lot of I don't know if postpartum doulas were available when any of my children were born. If they were, I didn't know about it. If I had known, I think I would have demanded to have a postpartum doula, especially with my last baby.
There's definitely a growing need.
Yeah. Mm-hmm.
I'm always looking for somebody to partner up with for those longer support.
Yeah. One thing that I wanted to just speak to a little bit and ask both of your input on is, I know that there's been some talk and some research really around the impact of having a doula during birth on reducing the risks of instrumental birth and cesarean birth. And I don't know if either one of you might want to speak to that, but I know that there are some, I think there's a meme or someone had said at a conference that if a birth doula was a medication, that it would be unethical to give it to the birthing person, right? Because the risk of C-section and instrumental birth goes down so much having a doula. So I don't know if you guys want to speak to that at all, but yeah.
Yeah. I mean, just the fact that we have other skills that we bring to the table, knowing, being able to kind of monitor and see, like, what's going on right now, and why are we still kind of, for lack of a better word, stuck here. Maybe there needs to be some movement. Maybe there needs to be some better coping so that she can relax, and actually physically relaxing her body will help with the descent. But we do a lot of extensive training. I mean, some of it's part of our requirements for certification, and some of it's just purely, driven by what we want to do to serve our communities and to serve our families. But we do classes and workshops, and we talk and we network with other professionals and other birth workers to find out, well, there was this really strange situation and we weren't really sure what to do. And then we help each other with different tools. It could be hands-on techniques. It could be relaxation methods. It could be using things like a rebozo, or using other tools besides just our hands to help with ideal rotation and descent for a baby, so that progress can happen, so that mama can relax. Sometimes it's simply an emotional barrier rather than a physical issue. Sometimes it's an emotional and anxiety, a feeling of being scared about what the process is, what's happening during the process. Even with all the preparation, there can still be things that come up, or there can be things that are unknown about until labor actually happens, and then these things start to come up. So sometimes it's simply an emotional processing of helping to find that relaxation, that ability to cope. And then knowing like, hey, you know what, we've been in this position for a while now, and I know that you're really comfortable. Let's consider moving to this position over, just maybe even just flipping you over to the other side, or maybe getting up and getting some movement in and making those suggestions so that progress can continue to happen. And simply those tools, being able to make those suggestions or being able to understand what might need to happen, or what type of hands-on we need to do at that moment, can help prevent, episiotomies or any type of intervention, really. I mean, even an induction, they're having those tools to know about what resources to give, to educate on, what information to give. That way we can look at what are all of the options, and sometimes just simply the families having that information prevents other interventions or more instrumental births, or even a cesarean, because we've been able to give more information and help them find other ways to cope or to move that maybe they weren't aware of before, or maybe weren't suggested. I mean, I'll have clients who have the full epidural and have no feeling, from here down. And I'll say, all right, I think we might need to flip you over on hands and knees. Like, but I have an epidural. How can I do this? Like, we can do it. We can absolutely do this. Like, there's a safe way to do it. And usually it takes, the help of the partner and sometimes the nurse, but it can be done. Whereas sometimes the clients are, if they don't have a doula, if they don't have someone to offer that tool, they might be stuck in a position that maybe isn't ideal for progress to happen. So, I mean, there's just so much that we can help with, that I think it does help. And not to say that everything works perfectly every time, because sometimes just babies are the way babies are sometimes, and sometimes it just doesn't, whatever we're doing for whatever reason doesn't work. But at least we have those options available to us. And at least I think it does help make the families feel a little bit more empowered, knowing that they did more than just, okay, well, I'm just stuck here. There's nothing else for me to do.
Mm-hmm.
So.
Yeah, and I've personally witnessed, sometimes providers can get a little hasty in making like, okay, so this is the next step of what's going to happen with interventions. And after speaking with, my client and her partner, and it was one of those, we talked about all the options that were presented to them, all of the risks, all of the benefits that are associated with it. And then they said, well, can we have more time? And so talked about that with the provider, and the provider's like, yeah, we'll give you 30 minutes. After 30 minutes, it was going to be a cesarean. And so I had to figure out, okay, so I got 30 minutes to figure out how we can get this last bit of cervix to disappear. And it was between we've done all the movement, we've done all the massage techniques, we've done all of that. And I finally was like, we got to relax. What will help you relax? And so she was a Christian, and she's like, I put on some music. So I put on this one song that I was like, Victory. I'm like, we got to find something that she can associate, the next 30 minutes with. And so Victory, she sang this song over and over and over for 30 minutes. And then just that being able to relax and release. And you can visibly, I remember I documented her demeanor went from tense and sad and stressed and scared to just it was a blank face in the, if you look at the picture, it's a blank stare, but it was a stare of relaxation that literally she finally was able to surrender her body and give in to the last little bit that she needed to give into. And she met her baby 14 minutes later. And it was just that having that, even with the hands-on techniques and all the education, sometimes we just have to say, okay, so what can we do to make you feel comfortable with this? A lot of times before cesarean is suggested, there are other interventions. So let's talk about it. Vacuum, forceps, these are all of the risks and benefits that are associated with it. And oftentimes it's talking with the OB, why would you recommend this? And they wouldn't recommend it unless they really think it's necessary. It's not like they just come in and say, let's get this baby out and So it's talking through, like they genuinely care about you and want you to pursue your birth plan according to how you feel is best and safest and what you will feel most confident in. And so talking through the partner, like, okay, so this is what it would look like. This is what, the benefits of it are. These are also the risks associated. What sounds best to you? What makes you feel safest? And then from there, they make the decision. And, sometimes just that time of talking is, you really don't need to make the decision, because then baby got just a little bit more time to get right where underneath the pelvic bone, or, it's just, it's funny how it all comes together. So, those I personally experienced, not have, but both of my births, I did not have my first two. I did not have a doula. This is my third, and I will be having a doula, but I didn't know about doulas then. And my first one was my traumatic birth. And I was just like, all right, I'll do whatever the care provider says. Like, my husband didn't know, so he didn't know to speak up for me. And I didn't really know. You walk in the hospital, you walk out with a baby. I don't know what happens in between. So like, tell me what it is. And it was really traumatic. And it did feed into my postpartum depression. Whereas my second, I did go in more empowered, more knowledgeable. Still didn't have a doula because I didn't really know the importance or how they would have like fed into, helping me achieve my dream birth. Having more knowledge and confidence definitely played a part in having a different birth experience. But I was also very blessed because my nurse had been a doula for 15 years and I was the only one laboring that day. So I got a little bit more one-on-one attention. Whereas I know if I had been a full moon baby with everybody else also having their babies, it might not have happened that way. So, having a doula there is just, it's that constant support and that just constantly feeding more knowledge. Knowledge is power. Knowledge brings comfort and safety and security keeps those labor hormones going, which keeps things progressing, because any amount of fear, like that's one thing that I stress. I like doing 2 prenatals because the second one I want to say, is there anything you're anxious, afraid, worried? Like, let's get it out. Let's talk about it now. I don't care what it is, even if it's down to I'm afraid of pooping during labor. Let's talk about it, because I don't want that to come up and literally will stall labor if you're worried about what everybody in the room is thinking. We've seen it all, trust me. Let's let it all go and let it all out so that you can fully relax and enjoy your labor. And if things do go against what you have been envisioning and planning, then doulas are there to say, okay, well, baby needed a better way, a safer way. You needed a better way, safer way to meet your baby. So let's talk about it. Let's process it. Let's help you feel at peace with the way things happened. So, I mean, even for planned cesareans, I love my clients that have planned cesareans, because they're still going in with the knowledge of they're making that it's not just a surgery where they slice you open, pull baby out. They're creating their birth plan of a gentle cesarean. If I want music playing, I don't want anyone talking. I want my baby to hear my voice first. Can we keep the lights down low? Can I do skin to skin with the baby? Like, it's all those things, being in control. We're not really in control, but we're still a little, have a little bit of control. So.
Yeah. And I think it's also helping in the prenatal visits to also kind of discuss and prepare for, not prepare as if it's going to happen, but understanding the reality that things might change, and that understanding that an intervention might become necessary medically for safety of mom or safety of baby, and having that knowledge beforehand and assessing those things beforehand and how they feel about it in the prenatal phase of it. That way, if it does happen to come up during labor, it's not as much of a disappointment or a shock or an adjustment, because they've kind of already discussed it. They've kind of already had some kind of conversation between the two of them, or even with all of us, about how do we feel about this? What kinds of things are we looking to avoid specifically? If this needs to happen, what are our best practices going to be about it? How are we going to cope with it? What are we going to talk about? That way, you try to go in with as few surprises as possible, still understanding that things might change. But if we've kind of covered it in a way where they understand that if this happens, we've already had this discussion, so we already kind of know what we want or what our options and the risks and the benefits will be, then it helps with that sense of being more prepared if something does need to happen, more instrumental.
Mm-hmm. Yeah. Yeah, I think it's amazing. I think the whole thing is just, yeah, really, yeah. I mean, it's likely sort of what was happening ages ago, even here in the US, right? Where we had people who were supporting us and that was their job when we gave birth. And somehow we really lost that over maybe just the last 100 or so years, really.
Yeah.
And, you know, bringing that back and normalizing the role of someone who's there just to support the mother, I think is huge.
Yeah, and like Tay said, sometimes it's simply time. With my first birth, I was in a hospital, and I remember I had a very good friend there with me, along with my husband, and things progressed very quickly. Like, I did not have a very long, crazy labor. Things were progressing well, but they still wanted to break my water, and they still wanted to do this and that. And I remember my friend just being the one to say, can we give her 30 more minutes? And they come in 30 minutes. She's like, can we give her another 30 minutes? And it was like, just needed someone to say that for me, to say like, let's just give her some time. And that's all I needed. And it wasn't even a crazy amount of time. I think I was in the hospital a total of like 4 hours before I actually birthed my baby. But it was just, I think with the way things go with maybe shift changes or schedules of the OB or whatever else they have going on, maybe it's many births happening at once in a single night in a hospital. But I think if we just allow that space for time, then sometimes that can be the best tool, is just, let's just give some time. Let's just see what happens. Like, doesn't really necessarily need to be a clock running on every single labor.
Mm-hmm. Yeah, absolutely. And I mean, I think birth and postpartum I can't think of a more vulnerable time for someone who's giving birth, or for a birthing person, I guess, is during that phase. And then postpartum too, right? You basically get your whole self opened up and you're having to manage this very primal experience. That's how it always was for me. Every birth, I was just like, wow, that was also primal. You know, it wasn't just your first one, it was the second and the third. And you're like, did that just happen? But having to balance that experience and not feeling like you actually have to advocate for yourself, having someone who's there to advocate for you, you know, both in that birth and the postpartum space. I think that part is huge because, yeah, I mean, you can relax. You can feel like, okay, nothing bad is going to happen to me. Like, it's going to be okay because someone is looking out for me. I think that's maybe the difference, you know, that I see in the way that I was treated, at least with my doulas in birth, but also in the postpartum. It's the same thing. We're wide open emotionally. And how do we have someone there to care for us?
Right. Because the nurses, the OBs, even the midwives, they can take care of all the medical side of it. And that's great. We want someone managing the medical side of it to make sure that things are safe. But we also want to make sure that there's somebody there to advocate for the emotional side of it, because the feelings, the emotions attached to it, the experience matters. And it has a huge impact how birthing people see their experience during labor and during birth. Hugely impacts the rates of postpartum depression, postpartum anxiety. If the more often that they feel like they were listened to, they were heard, they were respected, and they were loved, has a far greater impact on them being able to have better mental health outcomes postpartum. So taking care of, yes, the medical side is covered. Now let's make sure that the experience, the emotional side, the how you are cared for, physically held, and space is held is cared for as well.
And then it's also important to touch on, like Jenny, you said, like having someone there to advocate for you. So it's also important to touch on, you know, doulas, we are advocates. We are advocates that most births are not a medical emergency. It is a natural process. It is important to also point out, though, with, you know, especially in hospital births, doulas, we don't really have the space to speak up for you. A lot of times what that looks like, advocacy looks like in a birthing environment, or even in a postpartum environment, if I'm noticing that a client or even the partner is feeling uncomfortable with what's going on, I personally can't address the care provider or the nurse and say that's not what they want.
Mm.
If it's a little like looking like an abusive situation, with then that's a different situation. But in most cases, I can't go to the care provider and say that they don't want that, or this is that's what they want. In a birthing situation, you have bodily autonomy, and if you're with a partner, if the birthing person is kind of like out of it, which there are often times where they literally have to go within and can't process anything. I mean, even giving two choices of an A, B, these are your options, they can't comprehend that. So there are times where I might, if I'm noticing something is going against wishes that we had discussed in the prenatal sessions, I might bring it up ever so gently with the partner. Hey, I remember we had this conversation about, birthing in a specific position, that she doesn't want to be on her back. So like, do you want to what do you think? And sometimes the care provider can hear that and kind of take a cue, or sometimes it gives the partner the tool to say, hey, she's not comfortable on her back. Can we try something? Can we put her on her side? Can we try hands and knees? Like creating that space to have that conversation. Now, if a client's alone, then I always talk with them. If I'm their only support system, and that has happened before, I ask them like, what role can I take? Like, what do you need in that space, in that time? And a lot of times it's just pointing back to the birth plan. Hey, what's on the birth plan? Or with postpartum, I've had clients who had to process, the care provider, like they've looked back at their birth video or something, and they're like, this is something's just not sitting right, and I don't feel comfortable, and I like almost don't trust this care provider. And so then I'll make, I can't go to the care provider and say, my client said this about you, and like, you need to make it right. A lot of times I'll say like, hey, why don't you try writing it out in an email, like make a journal or give them a call. Like sometimes calling it feels uncomfortable, so write them an email and just give it to them, so that way they can process and learn from that, so it doesn't happen again. And oftentimes that's therapeutic and healing and recovering from whatever thing they didn't like, and so just creating options, or creating space and creating opportunities to speak up for yourself or have your partner speak up on your behalf. And then in extenuating circumstances, obviously, if I'm seeing something that's absolutely just not right, then, I gladly speak up. But oftentimes we can alleviate those, and the partner can speak up on behalf, or the mom can just be like, yeah, don't, no. So while we are advocates, we also give you the tools to advocate for yourself, because at that point, nobody can tell you no. They can tell me no, but they can't tell you no. You're the person who's bringing this baby in this world. You're the person who's taking care of this baby. Your mental health, your physical health, your emotional health, that all matters. So here are the tools to speak up for yourself. Even if you don't like conflict, it can be it doesn't have to be a conflict. It can just be like, hey, I didn't like that, and I need to tell you that so that I can heal better or more effectively.
Mm-hmm. Thanks. Thank you both for that. I know we have time for a few more questions. If anyone has one, anything that you've been kind of wondering about or curious about, I'll pop and see if there's anything on Facebook Live that we should be asking or answering. Just see real quick.
I have another question in the meantime.
Yeah.
So obviously these services are very valuable and can be very helpful to both the birthing person and the partner. But I know for a lot of people, the hurdle of paying for these types of services is quite large. So what kinds of resources are available, or like options are available for people that may have a difficult time paying for these types of services?
So There are some groups and some doulas who do sliding scale payment plans or reduced rates based on income. Something that's kind of a passion project of mine is, and I know Tay kind of shares this passion as well, is providing services to families in situations where either it's a shelter situation, it's a group home situation, and being able to provide those services. So for me personally, for my business, I offer my clients who are paying, I offer them the option to donate towards that so that I can take on those clients without the client who's in the domestic violence shelter or in a group home, without them having to actually pay out of pocket. As far as clients who are able to pay, or who maybe need help seeing maybe they're able to pay, and we just need to look at what their ability is. Maybe it needs to be a payment plan, maybe it needs to be a sliding scale, maybe it's a discount because it's a military family. It also has to come down to also a little bit of mindset for people who are able to pay, whereas we invest in the car that we want, the home that we want, the wedding that we want, the education that we want. This is another investment, and this experience is so important, and it impacts greatly the rest of your life, the rest of your experiences, whether you're going to have more children or not. That alone, the experience alone, can impact that even that question. But it also can impact the relationship between you and your partner. It can impact the relationship between you and your newborn or your other children. So looking at it as an investment, and we put money into things that are very important to us. This really should feel no different. Now, like I said, in those specific situations where there's a different need. Tay and I, both of us, have worked with families who are in domestic violence shelters or group home, teens in group home situations, families who are where they have no support. It's just the mom, and she has nobody else to support her. And in those situations, we've worked with certain nonprofits to provide those services at no cost, because for me personally, I know that anybody who feels that the support is valuable enough for them to seek it out, I want them to have it. So there are things that certain groups of doulas will do, or individual doula businesses will do. And it's something that needs to happen more, especially in the environment. There have been talks of things going through legislation through the state to provide. There's a couple of insurances that are looking to bring on some kind of a doula reimbursement program, and those are all great steps. But it's definitely a conversation that needs to be had more, and it's definitely something that finding that community of doulas who are willing to do that as well and take that on as like a side project or a passion project it's a huge need, especially in our community. Like I said, my clients who are able to pay, I invite them to donate towards that so that I can provide those services, because I want if someone is seeking it out and they sincerely cannot pay, and they have a deeper need, then I want them to have that. I don't want that cost to be an issue. That being said, this is also my livelihood. So I also do need to have paying clients, because I have a family, I have 4 children, and I have, this is something that I want to be able to be successful. So it takes both sides of it. It takes the clients that have the ability to pay, and it takes the side that where it's truly my heart, where I want anyone who wants this to have it, because I feel it's that valuable.
Mm-hmm. And then there are also options. So like I personally can take HSA, FSA, and then I have an NPI number to where you pay, and then you can submit the invoices to insurance. It's not always guaranteed that they will reimburse you, but sometimes you can. And I mean, it's always worth a shot trying with your insurance versus not. So for those clients that do have insurance or health savings accounts, there are a lot of doulas that can accept those payment options as well if cash is not readily available to invest. But when you put the money away anyways. Doula support is not, it's not a luxury. It shouldn't be a luxury. It shouldn't be viewed as a luxury. It should be, viewed as a drug that's unethical to not administer. It's definitely important. I've seen the importance the more that I've delved into it, and I've seen in my past experiences, man, like had I had a dual, like things might have, my first baby might have still ended up in the NICU, but I would have had a little bit more help processing what was going on. And so, yeah, I'm definitely very passionate that everybody has access to a doula. I know TRICARE just pushed through a bill to support doulas for military families. It's a step in the right direction. There's some things that could be improved by it for sure. Talking from a doula perspective and livelihood and all of that, but it's still a step in the right direction, and we take it. It's a win. So now if we could put that on a national level for everybody, and then we do need here in the Valley. We do, Lisa and I we've worked with a nonprofit that's since closed. So now, it's waiting for the right opportunity or investors to help us start another nonprofit. So that option is there, where there, a lot of doulas will take on, one per quarter, like of a client who really needs it. But, it's just a matter of figuring out how can everybody contribute to that, so that those who really can't afford it or don't have access to it can attain one, so one day a doula will be at every birth.
Great question. Yeah, I know. I think South Phoenix Healthy Start actually does some work with providing doulas for families in certain zip codes. So that's one option if you're in the right area. But other than that, I think that's the only one that I know of that provides. Yeah, South Phoenix Healthy Start.
Okay.
Yeah, that's it. And yes, there's definitely a lot more need for doulas than there are doulas, or than there are, is the funding to support them. And I think that's the other real big challenge is, like, as we start to think about how to make birth and postpartum a safer time for moms and babies and their families, we got to look at these things that we know help and figure out how to systematically support it, because I think that's one big piece, right? The answers are there, but often we don't systematically invest in them.
Yeah, I mean, the evidence and the research behind having a doula and the benefits are there. They're out there. They've been published. So I mean, it feels like it's something that shouldn't be so much of a struggle to get people to see and then to invest in or to support. But for some reason it still is. And I mean, as part of it, I think, is a little bit of education. There are still people who are like, what is you're a what? You're a birth doula. So does that mean that you're a midwife? Like, well, no. So there's still a little bit of that education, but the evidence is there to support that having a doula present for birth and postpartum it has only benefits, and it only reduces rates of things that can impact negatively down the line. So yeah.
Well, and then we're also shifting. It takes like 30 years for science and evidence to catch up to where we need to be. And I think we're still, back in the day, when my parents were birthing, it was like you still had to, when my grandparents were birthing, it was several women in a room birthing at the same time. And then they shifted to, you got your individual room, but men weren't allowed to be in there. And then it was like, well, no, having them in there, the partners there and family there. So we're just now getting into, like, birth isn't supposed to be just, and even postpartum, it's not supposed to just be like a quiet, not talked about, like you go in, you come out and you have a baby. Like we need to talk about it. It's the foundation of our earth to keep going. Like, so, it shouldn't be a taboo conversation. And I think putting that awareness of, like, support in birth, support in postpartum, support when you're trying to get pregnant, support when you have to make the decision of getting an abortion, support. Like that's, we as humans, as mammals, we need that. And so definitely getting the education out there, and definitely like just destigmatizing, I think is the word, of destigmatizing birth and postpartum and these expectations of what Hollywood makes it look like and what the reality of it is. We need to start focusing on what's the reality and how can we improve it, because those who think of birth, all we know is what Hollywood portrays. How we need, let's get away from that. Like, let's talk about what reality is. Postpartum, you get all cute, you snap back culture, like get your body back after you push these babies out, and or have them cut from you and your abdomen, like all of that stuff, like snap back to your body and get back to cleaning your house and all of that stuff. Okay, what about my emotional state, my mental state, my physical state? Like let's raise awareness of that and start focusing on supporting our families through that. That's catching up slowly but surely.
Absolutely. Yeah, absolutely. I'm hoping that we get there slowly too. I mean, quicker. I would like us to get there quicker, but yes.
Yeah, tomorrow would be nice.
So, so how can people on Facebook, and how can people in our Zoom group today, how can they get in contact with you if they wanted to talk more, learn more about the different services you offer, or some of the things you've talked about? What are the best ways to get in contact with both of you?
So I'm Tay. I'm solo doula at Nurtured Empowerment. So you can either meet me at the West Valley Birth Expo next Saturday, or you can reach me my Facebook, social media, Nurtured Empowerment. My first name's a little complicated, Tahanita Bush. So that's, Tay, I go by Tay. So you can reach me, nurturedempowerment.com, and get in direct contact via email. But social media is usually the easiest way to get a hold of me.
Okay, awesome. How about you, Lisa?
Same, social media, Instagram. I'm a solo practice as well, Mama Doula. It's MAMA, Mama Doula, and I'm on Instagram, Facebook. My website is themamadoula.com. It's actually going to be up in about a few days. So, but I'm on Doula Match and Instagram. All that social media is probably the best. My contact information is on there as well. And I'll be at the West Valley Birth Expo, so you can come meet me there.
Awesome. All right, thank you. All right, well, I'm going to go ahead and have everybody sign off now. I'm going to stop us on Facebook. So bye, Facebook land.